My name is Dr. Bill Brucker, and I'm a metabolic physician who practices out of Hasbro Children's Hospital in Providence, Rhode Island. I take care of a lot of different children who have ketotic hypoglycemia, and I had to ask myself, why did I want to give this talk? And the answer is that my preferred method of treatment is usually to take people who are either at risk or in crisis and to give them IV dextrose until the ketones are eliminated from their blood and they're able to eat. And it convinces me that they're out of the catabolic state responsible for keeping their blood glucoses lower or leading them into low blood glucoses. I'd always wondered, was there a better way? Because many of these families were hospitalized for 24 to 48 hours while their children were getting treatment. And is there a way to modulate the flow of metabolites so that maybe this could go from being something that's often an inpatient type of management to something that is an outpatient type management? And I actually kind of found that maybe there is, and that would be with the metabolic effects of steroids, which are some of the few things that can absolutely alter the flow of metabolites in the body. So the goals of this presentation are to discuss something called bovine ketosis that's actually ketotic hypoglycemia of cows and is a major problem in the veterinary industry, and the role of how this is treated with corticosteroids, which supercharge the gluconeogenic pathway by flooding the blood with amino acids. I would talk a little bit about the mechanism of how this goes and discuss a case of croup in a patient with idiopathic ketotic hypoglycemia who is very brittle in our own service. And this is a caveat. It is not any type of trial, but an interesting observation that I would hope would lead to a comparative effectiveness study in the future at our institution. So a brief foray into veterinary medicine. So cows, after they milk, can develop something called bovine ketosis when they enter into a hyper metabolic state and become very difficult to wrangle. They're given big doses of corticosteroids, among other treatments, to try and subvert this state and restore their blood glucose levels and eliminate the ketones. After cows are born and during lactation, the energy demand in cows increases substantially. One of the effects on the dairy industry is their ability to produce milk goes down, and the cows don't want to eat anymore. And they develop signs of neuroglycopenia, which is low blood glucose in the brain, which is irritability and decreased coordination and generally being difficult to wrangle. One of the treatments is gluconeogenic support called propylene glycol, but one of the other treatments is corticosteroids, namely dexamethasone. So normally in a fast, there's a flow of free fatty acids that get burned into acetyl-CoA that become ketone bodies. And then there's also a flow of gluconeogenic amino acids that comes from the skeletal muscles and is converted into glucose through the gluconeogenic pathway. In ketotic hypoglycemia, there's a little bit more burning of fats and a little bit more production of ketone bodies. And as the catabolic state goes on, the amount of amino acid released from the skeletal muscles starts to dwindle, and blood glucose levels generally decline over time until an individual reaches a crisis state where the brain develops symptoms of low blood glucose called neuroglycopenia, which can be sweatiness, lethargy, even as bad as epilepsy. In ketotic hypoglycemia in these cows, they use propylene glycol, which gets converted into lactate and then can enter the gluconeogenic pathway as pyruvate. And they basically do a propylene glycol wash, so they'll give the cows a lot of propylene glycol orally. And all of that propylene glycol, eventually becomes glucose. And so much glucose is produced that insulin is activated and it turns off the ketone bodies. This kind of doesn't, correct the gluconeogenic issue, but it does provide an additional avenue of gluconeogenic support that can help break this catabolic phase. There was a group that did this in children. It was a group out of Washington University in the 70s, and the researcher who did it was Dr. Pagliara. And he took children who had ketotic hypoglycemia and would provoke ketotic hypoglycemic state and then infuse them with alanine, which is a major gluconeogenic amino acid. And then their blood glucose levels would go up and their insulin would turn on and their ketones would turn off. And so this was kind of something that would support a mechanism of increasing gluconeogenic flux in order to eliminate ketosis. And there is a medicine, as I said before, that does this, and that's corticosteroids. So this is usually viewed as a nuisance effect of corticosteroids that could be applied to children who have ketotic hypoglycemia, where what basically happens is a dose of steroids would cause a massive amount of release of gluconeogenic amino acids into the bloodstream, and it causes large increases in blood glucose, otherwise known as hyperglycemia. So this is considered to be a nuisance state if you're treating something like croup or asthma, where you would use a steroid, but this could also be something that would be beneficial if you were trying to get someone through a catabolic crisis. Corticosteroids inhibit fatty acid oxidation as well, so the ketones are actually eliminated at the same time. So our story was, this was basically a 3-year-old male with croup who was very brittle and had 4 prior admissions for ketotic hypoglycemia, with each admission lasting between 24 to 48 hours long. On the day that he developed croup, he really wasn't able to eat at all and was going to go into crisis. And he had a morning blood glucose of about 71 and had already had moderate ketones. So the longer he was in this state, he was probably going to go into crisis. So he would be someone that we would typically have admitted until his metabolic state had improved. He was given a standard dose of dexamethasone to treat the swelling in his throat caused by the croup of about 8 milligrams, which is right in normal dosing range for croup at his pediatrician's office. He was able to be kept at home because his mother had a glucometer and ketone strips, and we just kind of monitored him with the thought that the steroids would significantly increase the amino acid concentration in his blood for a prolonged period of time. Dexamethasone can last up to about 3 days, and that was closer to what he got. His glucose levels were more than 100 for more than 30 hours, and the steroids had also stimulated his appetite to improve his caloric intake, and he didn't require admission at all and did quite well. And this is essentially a graph of when the dexamethasone was given, and you can see that the moderate ketones, which are listed as 100, declined to nothing after several hours, and his blood glucose was well over 100 for most of that illness state. So it provided a sort of a shield of glycemic protection to kind of guide him through that crisis. So in closing, substrate-based gluconeogenic support is used to treat ketotic hypoglycemia in cows, but might actually have another role in treatment in humans. You would give someone dexamethasone to treat croup or asthma, and you wouldn't give a second thought. So why couldn't it be used to treat ketotic hypoglycemia and provide extended glycemic protection for someone who's in crisis that may not be able to get to an emergency department very easily, or to potentially avoid a 2 to 3 day hospitalization. We would have to do more work with a comparative effectiveness trial to compare sort of standard care to dexamethasone support before we could make further conclusions. But I did think this was an interesting way to potentially change the flow of metabolites and provide protection to children with ketotic hypoglycemia. And thank you very much for having me give this talk.